My name is Bo Hu. I'm a research officer working for the Personal Social Services Research Unit at the London School of Economics and Political Science.
How would you explain what you do to a layperson?
My research focuses on long-term care financing, especially long-term care for older people in mainland China. This is to understand the drivers of long-term care demand and to look at how much money the government will need to spend to meet the care demand.
So you'll be speaking about mainland China today.
Yes.
What would you say are currently the three main policy priorities for long-term care in China?
Currently, the three main policy priorities are expanding the care capacity, building the long-term care insurance system, and setting out the eligibility criteria for publicly funded care. For the first policy priority, the government has spent a lot of money to invest in this sector. This is to increase the number of long-term care facilities, the number of care providers, and also the number of workers working in this sector. For the second policy priority, it relates to how the long-term care system is funded. At the moment, 15 cities in mainland China, in different regions of mainland China, are running a pilot of an insurance-based long-term care system. For the third one, it aims to ensure that the long-term care services can be delivered to those older people who need them most.
To what extent do you think these policy priorities have changed in the last 5 years, if they have at all?
For the policy relating to expanding the care capacity, this has been the priority for more than a decade. In the past decade, a lot of resources have been devoted to subsidizing the care providers and helping them to get on their feet in the care market. On the other hand, for the other policy priorities, it is only in the last 2 years they have become a priority for the Chinese government. Actually, what we are seeing here is a gradual shift of policy priorities and government resources from care providers to service users. For example, for the first policy priority, when the government devotes a massive amount of resources to this sector, this is to help the care providers. But for the other two policy priorities, the focus is to make sure that more and more older people in China can receive publicly funded care. And as I have mentioned before, this is also to make sure that those older people with care needs can receive long-term care services.
If you have an opportunity to introduce one new long-term care policy in China, what would it be and why?
I would introduce government support for unpaid care, for unpaid carers. The Chinese long-term care system at the moment relies heavily on unpaid care provided by family members. It is projected that in the following 2 decades, demand for long-term care will double. But on the other hand, the fertility rates in the Chinese population have been dropping in the past few decades. It is projected that the number of working-age adults will decrease in the following decades. This means that unpaid carers in the coming years will face more caring responsibilities. Surely, formal care services can share some of these caring responsibilities. But one thing we should remember is that the Chinese society has a set of very unique social norms, social values, and some older people have a strong preference for unpaid care. This means government support for unpaid carers will be very important. Studies conducted in high-income countries have confirmed that if this type of policy interventions or government support, if they are carefully designed, they can actually empower unpaid carers. and help them carry out their care tasks effectively.
So in terms of research priorities, what do you think is an outstanding piece of research on long-term care needs that needs to be carried out in China?
I would say that research on the implementation of long-term care insurance system in the 15 pilot cities would be very important. And this would involve a thorough investigation into both the process and outcomes of the policy implementation. The Chinese government has a very decentralized system, which means local governments have considerable discretionary power. The central government has formulated the long-term care insurance policy, but it is a very general policy framework. It is down to local governments to exercise their discretionary power when they implement this policy. So it would be very important to understand the variances of the implementation of this policy in different cities. I think there are 4 questions that need to be addressed in the first step. For example, where does the money come from, and who is covered by the insurance, and what are the eligibility criteria for government support, and what is the level of government support. As for the outcomes of policy implementation, I think it will be very important to understand the impacts of the long-term care insurance system on the pattern of care utilization.
So I'm now going to ask you a few quick questions. I'm looking for a number in response from 1 to 10, where 1 is low and 10 is high. What policy priority is allocated to long-term care in China?
I think I would give it a score of 6. This is because of the rapid population aging in China, and a lot of attention has been paid to the impact of population aging on service demand.
How aware is the general public in China of what the long-term care system offers to them?
In general, I think I would give it a score of 4, but there are huge variations in the general public and in different parts of the country.
How well does the system support people with long-term care needs?
If we take account of unpaid care, I would give it a score of 8 because, as I have mentioned, the Chinese system relies on unpaid care heavily. But if we only include formal care, probably I would only give it a score of 3.
How well does the system support the needs of carers?
I would give it a score of 2. At the moment, there aren't any policies that I know of that support unpaid carers, and this is a policy I would argue would be very important for the long-term care system.
How integrated are social care and healthcare services in China?
My score would be 3, and the integration between social health and social care has been mentioned or advocated for by the government for years, but unfortunately, there haven't been a lot of action. There haven't been a lot of action directly directed towards this item.
Thank you very much for your time.
You're welcome. Thank you.